10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Welcome back to Diabetic Foot Files. Today is the beginning of an amazing month that deserves way more attention than it receives. And it is June, so it's not just Hot Girl Summer Awareness Month, right? Is Wound Healing Awareness Month. So, yay. So, some people celebrate football season. I'm totally down for it. Draft week, all that jazz. Some people celebrate the holiday season, big Christmas person. I love Shark Week like the next person. But in the world of wound care, we're celebrating something that changes lives every single day, and that is the ability of the human body to repair itself. So today we're going to celebrate Wound Healing Awareness Month. We're going to talk a little bit about wound healing and why it's so special. And I honestly dedicate this episode to all my amazing patients. I am so proud of you. All my patients that healed themselves, they were able to, they had faith. And I want patients and anybody out there to know that there are a group of people, dedicated, passionate people who are dedicated to helping you heal your wounds, save your limbs, help save your life. So you're not alone in this battle, okay? So that's the whole point of this as well. So let's dive into it. And yeah, welcome to Diabetic Profile. So, what is Wound Healing Awareness Month? Wound Healing Awareness Month is dedicated to increasing the public understanding of chronic wounds, diabetic ulcers, pressure injuries, venous ulcers, arterial ulcers, surgical wounds, burns, and traumatic wounds. The goal is simple, pretty much, is that to educate the public that wounds are not just a cut. Some wounds become chronic, some wounds become infected, some wounds become limb threatening, some became life threatening. And yet some people have never heard of wound care specialists, which is amazing, right? Some people never knew that there were wound care specialists. Many people don't know that wound care centers exist. Many people don't know that there are actual limb salvage programs that exist. Many people don't know podiatrists save limbs every day. And that's why this has to change. And that's why Wound Healing Awareness Month matters so much. Wound Healing Awareness Month is not just about wounds, it's about the people. It's about keeping our fathers and mothers walking, dancing, our grandparents wanting to hold their grandchildren, keeping our workers employed, help preserving the dignity of our patients, preserving the independence of our patients, preserving the lives of our patients. Every wound has a story. Every patient has a story. Every scar has a story. Every person deserves the chance to heal. Everybody deserves a fighting chance to try to save their limb. Everybody deserves the chance of high quality health care. So in this month, behind every wound is actually a human being. This is just not a wound. And I'll tell a little story quickly about one patient. Every patient changes my life. I love all my patients. I don't think people really understand how intimate wound care is. It actually is a hands-on field where you literally have to wrap, you have to heal, you have to remove dead parts. Patient has to trust you and not move, you know. I get concerned sometimes when I see a patient and they don't understand how important debridement is, especially if they have a history of an ulcer, right? If they don't understand how important debridement is extremely important. I didn't understand how magical debridement was until I remember one time I saw this is like shortly after graduating from podiatry school, and I was just, preceptorship and all that jazz with wound care people, and they cut a wound. It was this, I would say the wound was like about 1 centimeter, right? And the doctor got the scalpel, and he pretty much did this deep circular scalpel cut along the entire wound, circular around, made it big and deeper. It looked like it was like 3 by 3 now, right? And the patient came back in 2 days, 2 days. And when took off the wound dressing, that wound looked almost fully healed. And it was like magic to me. I was like, whoa. And that's when the light bulb went in my head. I was like, oh wow, like I debridement really is like a wand. I never seen anything like that in my life, and it made me realize how much the body wants to heal itself. And then another story is my one of my most beautiful patients. She didn't understand how important debridement was. They got scared because they're thinking that you're making the wound bigger, and they wanted to cut off her leg, unfortunately, and, she said no, and they discharged her, they gave her IV antibiotics for a few weeks, but they did not debride her wound, and I'm not talking about some simple little dirty wound. I'm talking about tendon fully exposed, your plantar fascial tendon, the plantar tendons are exposed, okay? Brown, gray purulence, swollen foot, completely swollen, and the wounds are top and bottom, exposed tendon at the bottom, like entire plantar aspect of your foot. And I believe this is my just suspicion that they discharged the patient because they were just waiting for the patient to get septic and come back and they could just cut off the leg. Because if anybody who has common sense and medical ethics know that if you saw that wound and that they discharged the patient with that, you'd be like, okay, yeah, that's absolutely completely medical negligence. She didn't understand debridement. And then when we started doing debridement, because I had to do pretty much every other day debridement on her, big time debridement. I even had to remove tendon parts, so, it works, right? But the fact of the matter is that that she did well. She healed, she began to trust. One thing I always tell patients, get your camera out, let's take pictures. If anybody stole my phone, they're in for it because there's a bunch of pictures of wounds in my phone. Yeah. But one thing I also do, I always get a release. I always write a release note from get my patient to sign it for me to get permission to take pictures of their wounds, okay? Because HIPAA, and you just want to be compliant and respect the patient's wishes if they want pictures taken of their foot or wound or not, okay? But eventually, she did fully heal, which was amazing. I'm so proud of her, but, unfortunately, the disease of diabetes is more than just the foot, and that's why I tell patients that it is very serious. I need you to follow up with internal medicine, your endocrinologist, glycemic control, vascular, and, it's more than just a foot wound, okay? When, there's a wound that has not closed, there's more things going on systemically, especially when a person has diabetes, okay? And like I said, it's not a miracle, it's a marathon. It requires a lot of patience. It requires, I think, patience and passion. That's what wound care, I think, requires patience and passion. I feel like people have to have a passion for wound care because it is a tedious job. I am so grateful for everybody that is in wound care that does that and dedicate their time to help save limbs and lives and use their amazing mind and creativity because wound care requires a lot of creativity as well. We have to be creative, we have to be innovative. I see it as jazz, like you have to improv right on the spot, but no matter what, you're gonna have to remove the dead tissue, but, I'll do an episode on something called pathergy because 'cause I'm talking amazing how great debridement is, right? But there's something called pathergy, okay? And that's something it gets worse with debridement, but we'll do a whole episode really on that, okay? But let's talk numbers. Worldwide, and forgive me, I had to, like, fix my microphone. So worldwide, hundreds of millions of people suffer from wounds every day. Their burdens include diabetes, obesity, peripheral arterial disease, venous disease, aging populations, and as populations age, chronic wounds do become more common. Yet, they rarely make headlines. Like they was explaining, cancer does get a lot of attention. Heart disease gets a lot of attention. Stroke gets a lot of attention, but wounds not as often. Yet, wounds are responsible for hospitalizations, disabilities, infections, sepsis, amputations, as well as death. And they quietly consume billions of healthcare dollars annually. So, why does a diabetic foot ulcer matter? Here on Diabetic Foot Files, Diabetic foot ulcers are our home field. Why is that? Because they represent one of the greatest challenges in medicine. Diabetic foot ulcers is simply not a hole in the skin. It is often the result of neuropathy, vascular disease, biomechanical abnormalities, repetitive trauma, immune dysfunction, hyperglycemia. The wound itself is only the final chapter. Like I always say, when I see diabetic foot ulcer, it is the surrender white flag flagging, and it's on the foot, and its body's saying, "I surrender now. It's taking over," right? And that's why you should look at a diabetic ulcer more widely than just the foot. It's everything in the body is pretty much getting taken over by the diabetes and the abnormalities and the imbalance itself. So the story of this diabetic foot ulcer has started years earlier. Many ulcers are preventable. That is absolute fact. And that's why awareness matters. And that's why I want patients to know the moment you get diagnosed with diabetes, you have to keep on it. You have to have a vascular doctor. You have to have a podiatrist, okay? Don't ever take anything easy when it comes to a callus. Don't ever take numbness easily, okay? Like, we have to target all these things ahead of time, okay? So humans have been fascinated by healing all the time, okay? Ancient civilizations used honey. I used honey. I love me some honey, okay? Right? Get more bees with honey. I had to use honey for wounds, and it has to be used on the right wound, that's why, okay? But it helped one of my patients' wounds that they wanted to amputate both of their legs, and I had to use honey to get the eschar off on her legs, and it worked. Hallelujah, right? Tree resonance, herbs. I'm not that person with the herbs and animal fats thing, okay? But that's what they used to use all in the back of the day. But they have manuka honey, okay? Manuka honey works well, okay? But it has to be used on the right wound. That's the thing. People think that people who aren't well versed in wound care, they think that wound care is a one size fits all thing, and that's not it. Anybody who knows wound care, it's pretty much alchemy. We're figuring out what works for the wound. Sometimes the wound has an appetite for honey. Sometimes the wound has an appetite for you know, silver cell, antimicrobial alternate. Sometimes the wound wants iodine. Sometimes the wound wants powder. Sometimes the wound wants antifungal. Like the wound has a different appetite every day, and you have to figure it out because what does the wound need? Because then it'll start behaving with what it needs. And then is it fungus? Is it biomechanics? Is it pressure? Is it neuropathy? You have to figure it out, okay? The Romans understood wound cleansing. Military surgeons understood advanced trauma care. Remember, I said I love. It seems. I mean, I'm learning so much from the VA physicians because it seems like they're spilling out some of the best wound care specialists in the world. Okay, I really appreciate them. And what is the greatest construction project on earth? Okay, imagine your body. Your body's pretty much the greatest construction project on earth. Okay, workers arrive, debris removed, supplies arrive, engineers develop a plan, and so your body is pretty much a construction work. Okay, so what is our healing team? Like, let's celebrate our workers in our healing team. Our platelets, they're like the first responders, right? Remember the phases of wound healing, right? Hemostasis, inflammation, proliferation, and remodeling. Key factor basis of it, okay? But platelets are our first responders. They help stop the bleeding. They also, what does the platelets do? They help release the growth factors and they call in reinforcements. Our neutrophils. Our neutrophils are amazing. They help kill bacteria. They remove debris. They secure the battlefield. And what happens to our neutrophils in diabetes? They are quite dysfunctional. Our macrophages are dysfunctional as well because our macrophages are our conductors. They help coordinate the healing. They direct the inflammation. They go from M1 to M2, okay? They signal reconstruction. Our fibroblasts are amazing. Remember, we need them during the proliferative phase. Our fibroblasts help lay down collagen. They are our builders. They help us construct new tissue. Our endothelial cells are our engineers. They help us build blood vessels. They help create our oxygen highways. And our keratinocytes, they help restore the skin coverage, okay? They perform our little biological miracle, okay? So why do wounds fail to heal? Okay, multiple reasons. Wounds require oxygen. That's what I said is our healing currency. They require nutrition. I say nutrition. Nutrition, blood flow, immune function, mechanical protection. Move one ingredient and the healing slows down. Okay, remove several and the healing stops altogether. And this is exactly what happens in diabetes. Okay, so who are our heroes in limb salvage? Okay, we have to celebrate every single hero in limb salvage. One of our biggest ones, definitely, like Dr. Rothenberg said, caregivers. They don't get enough attention, but we have to celebrate our caregivers. The patients notice that heal really well. They have really great caregivers, a good support system. My beautiful patient who started my big time advocacy journey in wound care, he was on his own, but we went through that journey together. It was amazing because you go through the journey of unemployment with them, no money, no transportation. You go through it all with them, and it's kind of amazing that they still see light at the end of the tunnel because they want to keep their limb. And then on top of that, honestly, a lot of them are scared of the hospital because the hospital is the one that told them they would cut off their limb, right? So they're very scared of the hospital, and I told them I will do my best. I will do my best if you do what I say, I will do my best, and we did. And y'all, I'm a big crybaby when I start seeing my patients walk, live their life again, and be happy because you have to understand, usually when patients come in with these bad infected wounds, they're not happy. They're discouraged, they're tired, they're exhausted. They're not the most optimistic. And then as time goes on, week by week, right? They see the wound getting smaller and smaller. They're excited. They're happy. They tell their family about you. They start going to events. They always ask me, like, am I okay to go? And I'm like, yeah, you're okay to go. Yeah, you could do this. And I'm always excited. Like when my patients be like, oh, I'm on a trip. I'm like, yay, I'm so excited for you. Like, but be good. Wear what you need to wear, offload, take care, check your feet every day, and they do, and I love my patients. They're so kind and so happy. I remember one patient, she wouldn't even look me in the eye at first. She wouldn't look me in the eye. She was very quiet. It was very interesting because I think she was used to that because I don't think the doctors were really talking to her like I'm a very I wouldn't say a talkative person, but I like to talk to my patients. I like to get to know my patients. And she was just quiet, staring up at the ceiling, wouldn't talk, just waiting. It was kind of like just waiting to be asked questions, and very timid. She was afraid that I was gonna say something like, "Oh, but this can't be saved." And as the weeks go by, she was just such a different person. She was happier. She was kinder. I love when my patients, they bring me gifts. So I had a patient knit me booties for me and my family. She was so sweet. Patients bring me gifts. I sometimes they bring me food because Gabby loves to eat now and then. I love me some food, especially some real good food. I love my patients. But they're all so sweet, but I just love seeing that transition of them feeling so comfortable because 'cause they're not scared anymore. That's the thing I love. They, like, smile. They smile when they see me. Not like they smile because they're not afraid of the appointment anymore. They're always excited to see how much smaller the wound gets. It's not like some dreaded thing. They start smiling and they're happier and we're joking and we're like, "Yay, look how good it's going," and it's such a difference, like night and day. So I just love that part too, and I want patients to know that wound healing is nothing scary. It's something of hope, and it's just trust us, trust us. I promise, just trust us. And that's the whole point. I want everybody who's on this podcast or doctors that I definitely trust. Like, if I can't do it, I'll send them to you. Yeah, these people I would trust, like with my family members, okay? I know that they will at least give them the best fighting chance, okay? So let me continue. Our Wound Healing Awareness Month is all about people like I said, caregivers, podiatrists, our amazing podiatrists, yay! Prevent ulcers, treat ulcers, perform limb salvage. Our vascular doctors, y'all already know how I feel about vascular. They are my son. Okay, restore circulation. Help me. We love you, vascular. We can't do anything without you, vascular. Infectious disease, y'all are the best. Y'all help us fight infections. Help us with clearance, okay? Y'all help us figure out what's the best antibiotic and the best coverage for our patients. Amazing. Our wound care nurses who help our patients get daily wound management, okay? Our physical therapists who help improve mobility and endocrinologists who help restore and glycemic control. Our nutritionists, I feel like people really underestimate how much nutrition plays a huge role in wound healing, okay? And we're definitely gonna target that again. Our orthotists, the people who help design our offloading devices, our diabetic educators who teach and help us heal when nobody else can teach and educate the patient better, okay? So it's a whole team and I am so grateful for everyone. And if I forgot anybody, please forgive me, okay? But we are all one in this. The power of prevention. The best wound is one that never happens, okay? So prevention includes daily foot checks. Patients, y'all know that. You should do it every day. I said at least 60 seconds a day. Check your foot, okay? Proper foot wear. This is summertime. I this is the season for first and second degree burns on the bottom of the foot because y'all are walking in the sand. I even heard on the news they were suing a cruise ship because the people were getting second degree burns on the platform of the ship because it was so hot from the sun. So don't walk barefoot, okay? Blood sugar management, smoking cessation, okay? Stop smoking. I think you already know that. Routine podiatric care, always follow up, okay? Follow up, early treatment. Because I know a lot of we always see it at the end when it's really, really bad. And that's because they first try to treat it themselves. Don't ever try to do that. And then on top of that, I'm on a couch. On top of that, they are afraid of what we will say. They're afraid that somebody will say, "We gotta cut it off." So they just try to wait it out as much as possible, okay? Try not to do that, okay? Do your research. If you have a wound and you know you don't wanna just try to contact a limb salvage specialist or wound care specialist and say, "Is there a way to save this?" Okay? Nothing's wrong with getting a second opinion if they say they have to cut it, okay? Nothing's wrong with getting a second opinion, okay? But I believe that the limb salvage specialists, they're people who advocate for you, okay? But, most amputations begin with a preventable event, such as a blister, a callus, a nail problem, a burn, a small cut. Awareness saves limbs. And then you have to think about our amazing innovations that are quite exciting. Cellular therapy, skin substitute, negative pressure, advanced imaging, artificial intelligence, smart dressing, 3D printing, regenerative medicine. Okay, I believe in the next decade of wound care is going to be so transformative. And, a message for patients. If you have a wound, do not ignore it. Do not wait. Do not assume it will heal on its own. Seek help early, okay? The sooner the wound is treated, the better the outcome. Every day matters. Every week matters. Every month matters, okay? So, this is Dr. G, and this is Wound Healing Awareness Month. I want to thank every patient, whoever trusted any of us with their journey, okay? You have taught us that courage does not look dramatic. Sometimes courage looks like showing up to one more appointment, and we appreciate it, okay? One more dressing change, one more day, one more fight, because that's courage, And, healing is not just medicine, it's spiritual too. It's about your perspective, feeling positive about it, okay? Because limbs are saved, lives are saved. So, I want people to keep healing, keep believing. We're going to keep saving limbs one patient at a time. And as we celebrate Wound Healing Awareness Month, remember, healing is not just ordinary, healing is extraordinary. You're the one who's healing. We're just removing the blockages that are stopping you from healing, okay? Every wound represents millions of cellular decisions made perfectly in your body, okay? Every limb saved represents a team who refused to quit on you. Every patient deserves access to that type of care. So this month, we're going to celebrate our clinicians, our researchers, our nurses, our therapists, our caregivers, our patients who fight every day against chronic wounds. And most importantly, celebrate healing itself. And I'm Dr. G. This is Diabetic Foot Files. Stay curious, stay vigilant, and keep saving those limbs, okay? And take care of your feet because they take care of you. And happy June, happy wound healing awareness month, okay? So yay. And yeah, happy June.